Right, well, millions of Americans had the opportunity to make changes to their Medicare coverage last fall. But the time to be proactive about your Medicare coverage doesn't end there. In fact, now is the time for you to make important decisions that affect your health and your wallet. Chuck Swensson is the Senior VP at UnitedHealthcare Medicare in retirement. He joins us with tips on how to make the most of your Medicare coverage in 2020. Hey, Chuck, how are you?
I'm doing great. How are you?
I'm doing great. You know, I think a lot of people think about trying to get healthy in general in the new year and staying healthy. What should people keep in mind when they're thinking about their Medicare plan's coverage in terms of that?
That's right. So many people picked their plans last fall, and here we are. It's 2020, so we should be getting the best out of our plans. So number one, the big thing is get to know your plan. Understand what's covered, understand what benefits are involved, and know that when you go to the doctor or you go to a visit or you need help, that you're not surprised by what it's going to take to do that or what costs are associated. Couple quick things that people can do is, number one, right now, what are the preventative services that come within the plan, whether it's a wellness visit or some screenings that you can have, and it's a great way to get ahead of the curve for the year for your health and for your cost. The other thing, too, is if you have a Medicare Advantage plan, a lot of these plans have a bunch of additional benefits that you could be using now, like going to the gym or possibly hearing aid coverage or possibly things such as vision or dental. So people could be using those benefits right now today.
I think that sounds great to people, and I love that you mentioned cost a few times because that comes up a lot, right, with older people, that many are on fixed incomes, and every single dollar that they have counts. So how can you work with a fixed income to make sure that you're managing your healthcare costs correctly?
You are absolutely right. Every dollar counts. I think many of those that are in a Medicare supplement plan, that's going to help cover the 20% that original Medicare doesn't cover, so there's a peace of mind with that. If you're on a Medicare Advantage plan for this year, you know what your maximum out of pocket could potentially be if you do have to pay, and so there's a peace of mind in knowing what that is, and anything beyond that is going to be covered, as well as what those co-pays could be. But a really good practical example, like a Medicare Advantage plan, many of these plans have what's called an over-the-counter credits or allowance. You're probably going to the pharmacy today or other days and buying sunscreen, over-the-counter pain medications, even vitamins. And a lot of these plans will actually give you credit to go get those. So you're probably paying for those today. So right away, there's some real practical ways to be saving dollars.
I think people just need to learn so much, as you said. And I think a lot of people think of their health care and their Medicare, you know, as really something that you buy to pay for your health care in general. So I think more health plans are making it more convenient for members to get the care that they need. So tell us a little bit more about that.
That's absolutely right. So use your health plan to be proactive. For example, and we talked about an annual wellness visit. UnitedHealthcare has a program called House Calls, and with House Calls, we actually send a registered practitioner to your home, and this is what they do, and they're great at it, and they love to do it, and they sit with you, go through the primary tests and questions you might have, maybe even go through your medications, see if you have any questions, and they share a lot of that information with your doctor as a partner. It's a great way to get ahead of any types of concerns that you might have, and most people that go through that end up really appreciating having that time. So that's one way to be proactive, but there's also additional ways where you can actually look at we know a lot of people want to be physically and mentally sharp as they age, so there's lots of great programs. Like we have Renew Active, where you can actually have access to gym memberships as well as cognitive resources to keep your mind sharp. So there's lots of ways to stay proactive about your health versus just when you need to go to the doctor.
Well, I think there's so much great information on your website about prescription drugs and all these different ways to take advantage of staying healthy and, like you said, being proactive. So I'm going to make sure I give that. But I want to thank you for joining us today, Chuck. We appreciate it.
Yes, thank you very much. Appreciate being here.
That website is uhcmedicarehealthplans.com to learn more. We'll be back after the break.